Earlier, I said that back pain affects an estimated 80% of people at some time in their lives. It is among the most common reasons cited for lost workdays and trips to the doctor. Acute back pain, that's pain of sudden onset, can become chronic, especially in the low back. As a result, there are a wealth of treatments, from over-the-counter medications, heating pads, and ice packs, to physical therapy and other hands-on or technological modalities, and often as a last resort, surgery. Many experts advise that learning best practices for lifting and bending, as well as regular exercise and stretching, can help prevent back injuries. We've already seen the complexity of the spine. Now you'll see that back muscles are just as complicated. There are a great number of muscles in the back, so many, in fact, that we consider them in layers, mostly related to their functions. Now here's a fictional story that we'll return to later to tie things together regarding muscle layering. After watching a competition on television, a group of teenagers decided to take on the sport of knife throwing. I bet you're cringing right now. My son works in the emergency department of our local children's hospital, and he can assure you kids are no smarter today than they were when our grandparents were young. In our scenario, the teens aren't very proficient with their knives, and one went to retrieve his blade from the target tree, not realizing another was yet to throw. The unsuspecting kid sustained a penetrating wound that was medial to his right scapula, situated roughly between the transverse and spinous processes of the right side of his spine, and slightly superior to the spine of the scapula. Before the knife was fortunately stopped by his spine, what muscles did it penetrate? Although the wound is less than an inch or so deep, it could penetrate at least 8 different muscles. So you can see what I mean by intricate layering. In fact, the first group of muscles we'll discuss are not really back muscles at all. They're muscles of the upper limb that happen to live on the back. Remember, muscles cross a joint to cause movement at that joint. And with muscles of the limbs, the origin is always proximal and the insertion is always distal. So our first collection of so-called back muscles are called the appendicular muscles of the back, because they take origin off the axial skeleton, either the spine or skull, for the anchorage that they need to gain their leverage. And they move some aspect of the upper appendage, so their insertion is either on the scapula, clavicle, or directly on the humerus. They're generally considered to be 5 of these superficial or appendicular back muscles: the trapezius, latissimus dorsi, rhomboid major, rhomboid minor, and levator scapulae. We'll mention them now since they're on the back, but we'll cover them in detail when we talk about the upper limb and its movements. The trapezius, sometimes called the trap, has a long origin from the base of the skull all the way down through the thoracic vertebrae, taking origin along the midline of the spine from the spinous processes of cervical and thoracic vertebrae. It inserts on the spine of the scapula and around to the lateral clavicle. Together, the scapula and clavicle are called the shoulder girdle or pectoral girdle. The trapezius is a good example of a muscle with a complex shape, somewhat like a trapezoid, and as a consequence, it has complex and even contradictory actions. If you use the upper fibers of trapezius, what do you think happens? If you just shrugged your shoulders to indicate you don't know, well, you're right. The upper region of trapezius elevates the shoulder girdle. What about the lower fibers? We use those to depress the shoulder girdle, as when you're sitting on the floor and use your hand to help push yourself up. What about the middle fibers? Those retract the scapulae, pulling them together, an action that some references call adducting the scapula. But because the trapezius attaches to the posterior skull, it can also extend the head and neck. The trapezius is supplied by the same nerve that serves the sternocleidomastoid muscle, the spinal accessory nerve, cranial nerve 11. What puts accessory in its name is that some branches from the cervical plexus assist or accessorize this cranial nerve. The latissimus dorsi is another muscle on the back that isn't a muscle of the back. It's a muscle that has its belly on the dorsal side of the trunk, originating from a layer of broad, flat connective tissue called the thoracolumbar fascia. The latissimus dorsi muscles, sometimes called the lats, insert on the anterior and proximal part of the humerus. Since the latissimus dorsi is posteriorly located, it has several jobs. It extends the shoulder, and since it crosses the axilla or armpit, it also adducts the humerus toward the body. Finally, because it attaches anteriorly, it can turn the humerus medially, as in rolling it inward toward the body. The other three superficial or appendicular muscles of the back are the levator scapulae, which, as its name indicates, elevates the scapula by originating on the transverse processes of some cervical vertebrae and inserting on the superior aspect of the scapula. It works with the upper fibers of the trapezius to shrug the shoulders, reminding us that muscles work in synergistic groups. And both the rhomboid major and rhomboid minor retract the scapulae in conjunction with the middle fibers of the trapezius. The rhomboids do this by generally originating on the spinous processes of thoracic vertebrae and inserting on the medial border of the scapula. Their slightly oblique orientation also lets them elevate the scapula and rotate it so that the shoulder joint faces inferiorly. The other thing we're reminded of by the rhomboids is our rule of adjectives. If we have a major, we'll have a minor. The rhomboid major is larger and more inferior, attaching inferior to the spine of the scapula, while the rhomboid minor is smaller but more superior, usually at and slightly above the spine of the scapula. Some cadavers show little differentiation between the two, while others have a clear division between rhomboid major and minor. Now, the next set of muscles that live on the back consists of two nearly paper-thin muscles that are often called the intermediate or respiratory back muscles. They're so thin that I have always thought they can't do much work in humans, and recent studies suggest they really don't have much, if any, role in respiration. Their names are the serratus posterior superior, located deep to the rhomboids, and the serratus posterior inferior, located deep to a small region of the latissimus dorsi. Like some other muscles very much involved in respiration, the serratus posterior superior and inferior are supplied by ventral rami of thoracic nerves, known as intercostal nerves. If you've had anatomy before, you may have heard of the serratus anterior, but perhaps not the serratus posterior muscles. Again, the rule of adjectives applies. We'll study the serratus anterior when we cover the chest and upper limb. As we continue deeper, we now reach the real action in the back, the true back muscles. These are muscles that act on the spine, not the upper limb or the rib cage. And with extremely few exceptions, these muscles are supplied by dorsal rami of spinal nerves, not ventral rami like the so-called respiratory muscles or the appendicular muscles, which are supplied by the ventral rami of the brachial plexus. If you remember, dorsal rami are the branches of spinal nerves that supply true back muscles, and ventral rami are spinal nerve branches that serve all other muscles of the trunk and limbs, or at least any muscle not supplied by a cranial nerve like the trapezius is. As I've mentioned, true back muscles are a complicated and overlapping collection of muscles located posterior to the spinal column that act on the spine. As a group, these muscles are known as the axial muscles of the back, since their origins and insertions are on bones of the axial skeleton. Sometimes they're also called the intrinsic muscles of the back. Remember, intrinsic means that a muscle's origin, insertion, and action are all in the same body part, like in the back, the foot, or the hand. They're also called the deep back muscles as compared to the superficial appendicular muscles or the intermediate respiratory muscles. But the naming gets confusing since even these deep or true back muscles come in layers. When I teach, I subdivide the true back muscles into 4 main layers: the splenius complex, the erector spinae group, the transversospinalis group, and an even deeper group of muscles called segmentals. There are even a few additional groups of back muscles as well. Okay, I realize this lesson may be getting pretty dense. So before moving on, let's look at the bigger picture and consider what we already know about the back. The spine is a series of stacked bones linked by the many joints and ligaments that unite the vertebrae into the spinal column. This architecture makes the spine stable while at the same time gives it the mobility needed to be flexible. But the movements and much of the support comes from muscles. All these true back muscles move aspects of the spine and skull, and all are posterior to the longitudinal axis of the vertebral column. But along with the joints and ligaments, these muscles help stabilize the spine. They are our postural muscles, active in all our body positions other than lying flat. Subgroups of these postural muscles take turns all day long, rotating the job of keeping the erect posture needed by the spine when sitting, standing, walking, or running. By taking turns like this, our back doesn't get tired. Instead, when we're sitting or standing, our butt or our legs get tired before our back does. The downside of this arrangement, however, is that these muscles are not designed to lift or support heavy loads. In fact, many evolutionary scholars conclude that the frequency of back pain experienced in humans is directly related to the fact that our bodies weren't designed to even stand upright, let alone lift heavy weights, and the evolutionary jury-rigging that has resulted in the upright posture of humans is a big part of the reason that 80% of us end up with some type of back injury or at least back pain at some point in our lives. Also, let's keep in mind that the names of these muscles are a human construct, created during early anatomical studies, but also important to modern health, clinical medicine, and exercise. To accurately describe where a muscle is, or to convey where a wound or other lesion is, we need precise language. So human beings have given specific names to observable muscle layers and even to regions of these true back muscles. Another thing to consider is that all of the muscles we're about to cover are not equally represented in different regions of the back. Some are only found in the neck region, others are more well developed in the low back, and so forth. Together, these stabilize and support the spine. But by working in groups, they can also cause group actions. Lastly, having studied and taught comparative vertebrate anatomy, the study of animals with spines, these axial or true back muscles are present to support and move the spine in sharks, amphibians, mammals, and other animals. In addition, even as far back as shark evolution goes, some 450 million years, these axial muscles are supplied by dorsal rami of spinal nerves. With that bigger picture in place, let's move on to the 4 major subdivisions of true back muscles. The first set are the splenius capitis and splenius cervicis muscles. And as their names imply, the splenius capitis attaches to the skull, while the splenius cervicis attaches to transverse processes of cervical vertebrae. This splenius complex is found only in the neck, and to me reflect a clear example of naming as a human construct, because this pair of muscles really has a continuous origin along the spinous processes of upper thoracic and cervical vertebrae. Early anatomists decided to differentiate them due to their dissimilar insertions. When you look at the splenius muscles together, you can really see the continuous origin. A splenius means plaster, like an old term for a bandage. And for whatever reason, early anatomists must have thought the pair looked like a bandage on the neck. The small void or window superior to splenius capitis isn't a cutaway. Deeper muscles can actually be seen through that void. When acting together, the splenius capitis and cervicis extend the head and neck. When acting unilaterally, they aid lateral flexion and head rotation to the same side, which remember is ipsilateral action. The next group or layer of true back muscles are collectively called the erector spinae muscles since they help keep the spine straight. These constitute the bulk of the large longitudinal blocks of muscle that can be easily felt on either side of the spine. Because of their differential development in various areas of the back, as well as for their different insertions, anatomists subdivided them longitudinally into 3 subunits. First, the iliocostalis group, which are the most laterally located. Then the longissimus group, which are intermediately located. And finally, the spinalis, which are most medially located, adjacent to the spinous processes of the vertebrae. I tell my students to help remember the names, think from lateral to medial of the phrase, "I like standing," since these muscles help keep the spine upright as when standing. The I is for iliocostalis, the L is for longissimus, and the S is for spinalis. Iliocostalis are the part of the erector spinae that go from the ilium of the pelvis up to ribs. Costal means pertaining to the rib. Longissimus goes the long way, all the way from the low back up to the skull. Spinalis is the part of the erector spinae group that is most well developed in the thoracic region, sitting closest to the spine. And as I like to say, but wait, there's more. To achieve the precise naming of locations that we really need in anatomy and medicine, anatomists also wanted a way to convey not just the lateral to medial subdivision of the erector spinae, but also the superior to inferior breakdown. So, for example, some of the muscles have a capitis region, like longissimus capitis. Some muscles have a cervicis region, like spinalis cervicis, and still others have thoracis and or lumborum regions. These blend very naturally in the body, and there are no dotted lines or landmarks indicating where iliocostalis lumborum ends and iliocostalis thoracis begins. So while I tell my students they do need to know the iliocostalis from the longissimus, from the spinalis, in my opinion, it's kind of unfair to ask whether a region is cervicis or capitis unless the pin in a muscle or arrow on a diagram is adjacent to the skull, so clearly in the capitis region, or perhaps in the very low back for a lumborum region. The third major group of true back muscles are the transversospinalis. They're so named because they connect transverse and spinous processes of vertebrae. Of course, not those on the same vertebra, since if a muscle originated on a transverse process and inserted on the spinous process of the same vertebra, it wouldn't cross a joint. The most it could hope to do, I suppose, is try to tug and break off a spinous process, but that's not how it works. Each transversospinalis muscle originates on the transverse process of one vertebra and inserts on the spinous process of another. As a result, they have an oblique orientation as they cross one or more intervertebral joints. Now, since they're posterior to the vertebrae, they extend, support, and stabilize the spine. But their oblique orientation also allows them to have a role in rotation of the spine. Remember, there's not a whole lot of movement between any two adjacent vertebrae, but stacking 24 of them allows the accumulation of slight rotations between adjacent pairs, adding up to a much greater range of motion within the spine as a whole. Keep in mind, however, that the major rotators of the spine are abdominal wall muscles that we'll study in our next lesson. Transversospinalis is a group name, and like the erector spinae, these are subdivided into 3 subunits: the semispinalis, the multifidus, and the rotatories. These are tucked in the relatively narrow trough between spinous processes and transverse processes. So rather than being considered from lateral to medial, these subunits are discussed in layers from superficial to deep. In general, the semispinalis muscles of the transversospinalis group span 5 or more vertebral segments, while the multifidus are deep to them and span 3 to 5 vertebral levels. The deepest members of the transversospinalis group are the rotatories that span just 1 or 2 vertebral levels. So for a bit more clarity, let's consider origins on the 7th thoracic vertebra. A semispinalis muscle that originates on the transverse process of T7 might insert on the spinous process of the T1 vertebra, spanning 6 spinal levels, since semispinalis span 5 or more vertebrae. A multifidus muscle that originates on the same T7 vertebra and inserts on the T3 vertebra would span 4 vertebral joints and would sit deep to the semispinalis. Then the rotatories span just 1 or 2 vertebral levels, so it would be deepest of all, directly adjacent to the bone themselves. A short rotator, as it's called, that originates on the transverse process of T7 would insert on the spinous process of T6. A so-called long rotator would originate on the transverse process of T7 and insert on the spinous process of T5, spanning 2 vertebral levels. Now you might be thinking this is overkill, but remember how intricate the vertebral column is, with superior articular facets of one vertebra joining the inferior articular facets of another vertebra, and the discs that bind the adjacent surfaces of vertebral bodies together. All this goes toward the importance of keeping the spinal column aligned and moving smoothly. So these many layers of overlapping and overlying muscles are part of that same supportive theme. The whole evolutionary design is really remarkable. Dare I give another, but wait, there's more? Oh, let's do it. In addition to the splenius muscles in the neck, the erector spinae that run the length of the spine and the transversospinalis group, there's a 4th set of muscles along the spine, generally called the segmental complex, as they span just 1 vertebral segment. Now, these are subdivided into the interspinalis muscles, a tiny pair of muscles that run between adjacent spinous processes, and the intertransversarii muscles that connect adjacent transverse processes. Now, up to this point, all of the true back muscles are supplied by the dorsal rami of spinal nerves. However, relatively recent studies have demonstrated that the intertransversarii are supplied by ventral rami, which I'm pretty sure is not how I learned it back when dinosaurs ruled the earth with true back muscles operating their spines. Speaking of dinosaurs, you know birds are modern-day dinosaurs. And while I'm not a fan of food analogies and gross anatomy, if you've ever roasted a turkey at Thanksgiving and worked with the neck to start the makings of gravy or maybe later to make soup, then you've seen all these tiny strands of muscle among the neck bones. Of course, these segmental muscles are much larger and stronger in humans, and certainly were in dinosaurs, at least the big ones. Okay, now that we've hit on most of the major groups of back muscles, let's return to the clinical layering issue I presented early in the lesson. Remember the kids throwing knives? The one guy had a wound medial to his right scapula between the transverse and spinous processes on that side. And the knife penetrated his back just superior to the spine of his right scapula. With everything we've learned, let's work through what muscles the knife penetrated from superficial to deep. After passing through the skin and subcutaneous fat, what muscle is pierced first? One of the superficial appendicular muscles, a large trapezoid-shaped one, yes, trapezius. Next, the blade would have penetrated another appendicular muscle. What's medial to the scapula? At that level, it would be the rhomboid minor, since the major attaches inferior to the spine of the scapula, and the minor attaches at and slightly superior to the spine of the scapula. Now, which member of the intermediate so-called respiratory group is deep to the rhomboid minor? That's the serratus posterior superior. Then the knife would have reached the true back muscles. Do you remember which group is most superficial of those and only found in the neck region? Yes, the splenius complex, probably the splenius cervicis, given the proximity to the scapula. Though remember, it shares a common continuous origin with the splenius capitis. Next, the erector spinae would be punctured by the knife. And given that the iliocostalis are lateral, the longissimus intermediate, and the spinalis closest to the spine, it's likely the spinalis would be in the path of the blade, since the wound is said to be medial to the transverse processes of the spine. Given that location, if stopped by the vertebral column, the knife would have passed through the transversospinalis. In order from superficial to deep, this would be the semispinalis, the multifidus, and finally the rotatories. Good thing an MRI can sort this out so surgeons don't have to guess like we did. Now, I can almost see you shaking your head thinking, there can't possibly be more to this back muscle business than this. Well, remember that unique joint between the atlas and axis, the one that's allowing you to shake your head right now? Let's go there. The spine as an entity moves in many ways. Flexion, forward bending, extension, the erect posture that is key function of the true back muscles, lateral bending, also aided by the true back muscles when only one side is used, and rotation. That's a function that the transversospinalis can assist abdominal muscles in performing. But what about the increased rotation that occurs in the neck because of the complex articulations of the first two cervical vertebrae? Well, there's a group of 4 muscles known as the suboccipital muscles that act in part as the steering mechanism at the base of the neck. Remember that the occipital condyles of the base of the skull are convex. These articulate with the concave superior surfaces of the atlas, the C1 vertebra. The atlas has very flat inferior surfaces that form a joint with the flat superior surfaces of the axis, the C2 vertebra. But just as importantly, the axis has that superior projection called the dens or odontoid process that links with the anterior aspect of the atlas. This atlantoaxial joint is the real source of the great degree of rotation we have between the head and neck. Not actually between the skull and the vertebrae, but between the atlas and the axis. Our final group of back muscles are the suboccipitals, a group of 4 bilateral muscles that form what is called the occipital triangle. The rectus capitis posterior major originates on the spinous processes of the axis and inserts on the skull. The rectus capitis posterior minor starts on the posterior aspect of the atlas and inserts on the skull. The superior oblique capitis originates on the skull and inserts on the transverse process of the atlas. And finally, the inferior oblique capitis originates on the spinous process of the axis and inserts on the transverse process of the atlas. Together, the superior oblique capitis, inferior oblique capitis, and rectus capitis posterior major all act to rotate the skull and C1 on the axis. The action is ipsilateral. The muscles on the right rotate the head and the atlas to the right on C2. The superior oblique, rectus capitis posterior major, and rectus capitis posterior minor all insert on the head and so also act to extend the head. All four of these muscles are supplied by what is called the suboccipital nerve, which is the name given to the dorsal ramus of the first cervical nerve. We'll learn in our next lesson that the first cervical nerve comes out between the skull and C1. So the name for this dorsal ramus, the suboccipital nerve, is literal. The nerve comes out below the occipital bone of the skull. And the only job of this nerve is to supply those four small but important muscles. The C1 nerve never reaches the skin, so you won't find it on a dermatome map. So it is an exception to the rule of spinal nerves being mixed. Another interesting thing is that the suboccipital nerve emerges from the triangle formed by the juxtaposition of the rectus capitis posterior major, superior oblique capitis, and the inferior oblique capitis. And deep within that triangle, if the muscles are parted slightly, you can see the vertebral artery. That same vertebral artery that snakes up through the transverse foramina of cervical vertebrae as it makes its horizontal journey from the transverse foramen of C1 and heads to the foramen magnum to enter the skull and help supply the brain. So, as you can see, the spine, as the main axis of the body, has a wonderfully complex set of muscles to achieve the support, posture, and movements we ask of it all day, every day. It's incredibly important that we keep these muscles strong and flexible. So, if you haven't already exercised or stretched today, maybe get up from your chair and take some time for your spine.